So what are probiotics? Nestled inside your gut are trillions of live microorganisms that make up the microbiome. And many of these bacterial cells are considered good bacteria. So they help support immune system, the immune function. They enhance nutrient absorption. They aid in the synthesis of key neurotransmitters and other compounds. Probiotics are a type of organism that can help boost the amount of beneficial bacteria in your gut. They are found in probiotic supplements and fermented foods like kombucha. It's very popular. The first and most overlooked reason that our digestive tracts are critical to our health is because 70 to 80% of our entire immune system is located in our digestive tract. Like, that's an astounding percentage. In addition to the impact on our immune system, our digestive systems are the second largest part of the neurological system. It's called the enteric nervous system, and it's located in your gut. And this is why it's called the second brain. The gut is responsible for creating 95% of the serotonin in our brain and may have significant impact on brain function and mood. So many health issues such as thyroid imbalances, chronic fatigue, joint pain, psoriasis, and autism are connected with gut function. And yet, it's not conventional practice for most people in the field of medicine to address the gut first when treating these conditions. According to the National Institute of Diabetes and Digestive and Kidney Diseases, upwards of 60 to 70 million Americans are affected by digestive diseases. In addition, digestive disease and disorders cost the United States over $100 billion per year. Every day, we are exposed to toxins and inflammation-causing molecules from food and from the environment that negatively impact digestion through pathways such as leaky gut. So in leaky gut, the tight junctions that are supposed to keep disease-contributing compounds from leaving the digestive system are disrupted, and that allows a lot of things through into the bloodstream that don't belong there. And this process is linked closely to inflammation, which is at the root of most diseases: autoimmune conditions, inflammatory bowel diseases, thyroid dysfunction, and nutrient malabsorption and mental issues, including depression and autism. Also anxiety, I believe, is connected to that as well, but depression for sure. So the secret to digestive health is all about balancing the good and the bad bacteria in your gut. And in this episode, I'm going to give you the top 5 reasons why probiotics are good for the overall health. Hi, I am Stephanie Phillips Markstein, and I help health-conscious people optimize their physical and emotional health so that they can show up in the world as the best and most confident version of themselves. So, 5 probiotic benefits for overall health. Number 1, the first reason to have probiotics as part of your diet is for digestive health. The first major benefit of a probiotic is as a promoter of good digestive health. According to a meta-analysis conducted by Dalhousie University in Nova Scotia, probiotics are generally beneficial in treatment and prevention of gastrointestinal diseases. So when choosing to use probiotics in the treatment or prevention of gastrointestinal disease, the type of disease and probiotic species, or strain as they're called, are the most important factors to take into consideration. You want to eat foods rich in good bacteria, and using probiotic supplements may help to provide protection from inflammatory bowel diseases, including ulcerative colitis and Crohn's disease. The evidence is stronger, however, for an improvement in ulcerative colitis, while Crohn's disease may not benefit as greatly. In addition, there is ongoing research that studies the role of probiotics in gluten issues, including celiac disease. So the second reason why we should have probiotics in our diet is for a decrease in antibiotic resistance. The World Health Organization considers antibiotic resistance one of the biggest threats to global health, food security, and development today. Bacteria become resistant to antibiotics due to the overuse of prescription antibiotics and the lack of diversity in these medications and also improper use of antibiotics. So by using probiotics, it's possible to actually help rebuild a poor variety of gut bacteria, often seen as a result of taking antibiotics, and prevent antibiotic-associated gut issues. In addition, probiotic supplements and foods may increase the effectiveness of antibiotics in the first place and help to prevent the bacteria in your body from becoming resistant. Number 3, they may improve the mental illness. So the second brain of the gut has been a major point of research since scientists have discovered the importance of the gut-brain connection. And a review in 2015 highlighted the complex interactions between the gut and the brain, stating that various gut-brain interactions seem to induce a number of disorders in which inflammation is implicated, such as mood disorder, autism spectrum disorders, attention deficit hypersensitivity disorder, multiple sclerosis, and obesity. The authors of the study discussed the need for psychobiotics. They call them psychobiotics. In other words, probiotics that impact brain functioning in handling the development of these conditions. This anti-inflammatory quality is what seems to interest researchers the most. The anti-inflammatory quality of the taking the probiotics. While no studies have been conducted in humans, early research suggests that in animals, probiotic supplements may help to alleviate the symptoms of anxiety by reducing inflammation along the gut-brain connection. I'm outside. You never know what's going to happen. Probiotic benefits seem to include a reduction in depression symptoms, according to a 2016 meta-analysis, the first review of its kind. So this is really new research. Taking probiotics might also help reduce rehospitalizations from manic episodes for those with manic depression. A slightly more surprising result, however, seems to be that the way that probiotics may impact some of the symptoms of autism. Autism and gut health have been discussed for some time, as patients with the disorder typically do suffer from a large number of digestive issues. However, based on animal studies, it seems possible that altering the quality of gut bacteria might benefit not only the digestive system, but the abnormal behaviors in autism as well. In 2016, a case study of a boy with severe autism was reported, and while being treated with probiotics for digestive problems, the patient spontaneously improved on the ADOS scale, which is a diagnostic rating system for people with autism. The score dropped from 20 down 3 points to a stable 17, and according to the report, ADOS scores typically do not fluctuate spontaneously along time and are usually absolutely stable. So it did decrease by 3 points. Because of results like that, human studies are currently underway to determine if probiotic supplements might improve not only the GI symptoms of people with autism, but also on, the core deficits of the disorder itself, cognitive language development, and on brain function and connectivity. So that's really exciting. Number 4 in our top 5 reasons is immunity boost and decrease in inflammation. So both probiotics and prebiotics are a continuing topic of research regarding immunity, and when used in conjunction, so pro and pre, scientists refer to them collectively as synbiotics. One 2015 review suggested that lab and bifidobacteria and novel strains of probiotics might be an additional or supplementary therapy and may have potential for preventing wide scope of immunity-related diseases due to the anti-inflammatory effect. So again, we have this anti-inflammatory thing going on with probiotics. Because chronic inflammation is at the root of many diseases and health conditions, the fact that probiotics exert this effect in the gut where 80% of the immune system lies is crucial. The benefits of probiotics seem to be particularly helpful for the quality of life of seniors. Currently, research is underway to test whether probiotics can reduce inflammation and improve gut immune health in HIV-positive individuals who haven't yet undergone treatment. And lastly, number 5 is healthy skin. Many avenues of research have examined probiotic benefits for skin, especially in children, and meta-analyses have found that probiotic supplements are effective in the prevention of pediatric atopic dermatitis and infant eczema. So the integrity of gut bacteria is also connected to the development of acne, although they don't really know how that happens. So that part is kind of unclear. The skin benefits of probiotics seem also to be connected to the reduction of inflammation seen in healthy gut bacteria. Again, it's the whole anti-inflammatory piece of it. So important. A particular strain of probiotic, LKC, can reduce antigen-specific skin inflammation. Research suggests that having a balanced gut environment has benefits for both healthy and diseased human skin. So, on top of all that, we have emerging research on benefits of probiotics for other conditions. And again, this is all new, so it's speculative right now, but preliminary research suggests that certain probiotic strains can help prevent or slow or maybe even stop the growth of bladder and colorectal cancers. The colorectal colon cancer, this effect may be increased by the use of prebiotics along with probiotic supplements. One review on the current studies regarding cancer and probiotics stated that evidence does not support that probiotic benefits may include an anti-carcinogenic action. However, the quality of trials available was low, and there needs to be more research done before a conclusion can be drawn, for certain on that. Dental health is another one that's emerging, in which probiotics might be helpful. In a current review in 2009, European scientists determined that probiotic therapy could be a potential new option for dental health. The first randomized controlled trials in humans suggested that certain probiotic strains may aid in the prevention of cavities. That's pretty cool. Next is urinary tract infections. There was a 2012 review that confirmed that probiotics do seem to be effective in preventing recurrent UTIs. But again, they need to do more research to make that final determination. And also rheumatoid arthritis. So because poor gut health is related to autoimmune responses like those found in rheumatoid arthritis, probiotics have been a proposed treatment option for the condition. But only a few studies have been conducted in humans, and only one test was able to find a decrease in RA inflammation and the progression of the disease. Lastly, weight loss. In the past, probiotics have been proposed as part of a weight loss diet. However, a 2015 meta-analysis looked at available randomized controlled trials investigating this effect and determined that the studies did not really seem to support this hypothesis, as body weight and BMI were not consistently reduced. The researchers did point out, though, that the need for better designed trials, because they weren't convinced that the results were based on well-designed science. So speaking of weight loss, in every episode, I try to offer something of value that will improve the lives of my viewers. And so to that end, I am giving away a free guide to the ketogenic lifestyle. It's called Keto for Beginners. And it's a quick and easy hack to help you incorporate the keto best practices into your life. So be sure to pick it up at the link below. I hope this has been helpful and valuable, and if so, please like and share this video and subscribe to my channel, and I will see you on my Facebook page on Saturday morning at 10 a.m. Eastern for Saturdays with Stephanie. See you there.